Welcome to ME 108. Um, this lecture we're going to talk about coding for pathology services. Um, let's start with anatomic pathology, which is 88000 to 88099. Anatomic pathology codes describe professional services associated with post-mortem examinations, post-mortem after death. Separate families of codes describe gross examinations only, such as physical inspection of the organs, and gross and microscopic examinations, both visual inspection and studying the tissue symptoms under a microscope. We have uh, cytopathology, which is 88104 to 88199. These codes report tests on cells obtained by a variety of methods, such as washings, brushings, lavage, scraping, the use of a swab. Uh, Cytogenetic studies is 88230 to 88299. This reports molecular diagnostic procedures. Excuse me. Um, Codes in this section can include cervical and vaginal specimens, pap smears. Uh, as I said, there are various ways to perform these. Uh, Pap smears can be done in physicians' offices or fully certified laboratories. Uh, but you have to know the method before you code. It's important to note that usually in a physician's office, the pap smear is only obtained, it's not read. So coders in laboratories are more likely to use these codes. Cytogenic tests are performed on cells to detect genetic abnormalities or neoplastic conditions, uh, things like that. Um, Surgical pathology, 88300 to 88399, describe examination of tissue samples removed during surgery to determine the cause of underlying disease or whether any disease is present in the tissue. Level 1 codes are for gross examination only. Surgical pathology levels 2 through 6 include microscopic tissue examination and represent increasing probabilities of disease or malignancies in the tissue. These codes are based on why the tissue was obtained. So different, levels of levels represent potential increased risk for abnormalities. 5 levels of surgical pathology codes represent increasing probabilities of disease or malignancies in the tissue. If an appendix is removed incidentally during another procedure, it's less likely to have a disease process than if it were removed due to appendicitis. This section of CPT is also used to report pathology consults regarding tissue specimens, and the codes are based on how the consult was done. Surgical consults during a surgical procedure may involve frozen section examinations during which microscopic examinations performed on a specimen before the surgery is continued or completed. You have in vivo laboratory procedures, 88720 to 88741. These codes are used to describe in vivo transcutaneous laboratory tests performed with transducers. Reproductive medicine procedures, 89250 to 89398. These codes are used to report lab services associated with reproductive medicine. Uh, in vivo laboratory procedures may be performed in locations outside the laboratory. Procedures under reproductive include in vitro insemination, preparation of embryos for in vitro fertilization procedures, and cryopreservation of embryos. Two or more panels may not be reported if the tests performed overlap multiple panels. If two or more panels list some of the tests, the largest panel in which all the listed tests are performed is reported, with any other tests reported separately. Qualitative tests determine whether a certain substance is present in the test sample, but they don't measure how much of that substance is present. Quantitative tests determine how much of the substance is present in the test sample. Drug testing, for instance, involves qualitative tests to detect the presence of one or more specific drug. If a quantitative test is performed to determine how much of the drug is present, the test is reported with an appropriate code from chemistry section. If we're doing therapeutic drug assays, these are quantitative tests to measure the amount of specific medication present in the test sample. Most often, these tests are used to determine whether a particular medication's in the therapeutic range, which is defined as the amount necessary to achieve the desired results. We also have evocative suppression tests, which include measuring the amount of any particular substance in the patient, giving the patient a drug or an agent to either increase or decrease that substance and then measuring that substance in the patients after given the drug or agent, whatever they've given. A single CPT code describes all required measurements, which is listed as part of the code descriptor. Laboratory tests, these include urinalysis, chemistry, hematology, coagulation, immunology, and microbiology tests, to name a few. Coders should be able to determine the correct CPT code to report for these laboratory tests by using the index to determine a complete list of the codes that describe a particular test, and then reviewing them in detail to determine which is the one that best describes that service that's provided. Back to anatomical pathology codes. These family of codes describe the gross examination and are limited to gross and microscopic examination and complete gross and microscopic. Surgical pathology examinations are divided into the 6 levels, as I said. Level 1 examination involves gross examination only, while levels 2 through 6 include gross and microscopic. Make sure to review your codes. Go through, do your work, and read, practice. Don't just do your work and say, I'm finished, because doing your work, you've forgotten the work in 30 minutes. You know, we tend to, what we do now only stays in the forefront of our memory for a short period of time. We want to make sure that we remember these. And granted, when you get out there, you'll be using drop downs. You won't be always looking in a book like we are now. You'll be using drop downs, but you still need to know where to look, and you have to look in several different places to get the correct code. So happy studies, and I will see you next week. Have a great day.